So why is it important to treat dry eye before surgery? Because there are certain problems that one can encounter. One is it affects the accuracy of your surgery in the first place. Because cataract and LASIK nowadays, we look at removing refractive error or correcting your spectacle number in these surgeries. It is important, therefore, to get accurate measurements because our lens power calculations are based on the shape of our cornea as well as the length of the eyeball. So it is extremely important to get accuracy in these measurements, and dry eye tends to interfere with that. So it is exceedingly important to treat the dry eye before taking these measurements, especially for things like intraocular lenses. There are lenses nowadays that we use, which are called multifocal lenses, where you can see for distance as well as near and your computer vision without glasses. Now, these are lenses that work very well if you have a very good ocular surface, a very good optical system of the eye. However, in dry eye, again, these lenses don't tend to work as well. As Dr. Matthew had shown, there is glare, there is scattering of light because of the dry eye, and that compounds the problem if you have a multifocal lens in your eye with that. So it's very important to treat these conditions beforehand. Again, measurement of the corneal shape, which is done by a topography device before LASIK and cataract surgery, is extremely important. And this is also affected by your tear film. So a tear film which is not proper tends to cause errors in measurement of corneal shape and therefore errors in the treatment that is done with the LASIK machine or with the implantation of intraocular lenses. So the problems that occur after surgery, if you do not treat the dry eye beforehand, is things like common complaints, and I'm sure a lot of people would have felt that as well. There is some amount of irritation or heaviness in the eyes. The visual quality disturbance, as I've shown in this image here, very often inside a clinic setting, the patient breathes till the last line, which is a 20/20 or a 6/6 vision, but the quality of vision is not great. And as you can see, the E image here, this is from a machine called the iTrace that simulates vision. What you get is a shadowing or a blurring of the edges of the alphabet. And this is very disturbing to patients post-cataract and post-LASIK surgery, where all conventional tools of measurement say that the vision is good. However, the practical quality of vision in everyday scenario is not really that good. It can also lead to quicker evaporation of tears, which again affects the optical quality of images, and a poor lipid layer in our tears. So as we mentioned, prevention is the best cure. Treating early is extremely important, and actually understanding what is going on is also important. So the first thing, if you have a dry eye, the most common thing to do is to start with lubricant eye drops. The question was asked which lubricants. Any lubricant generally does fairly well. However, it is important to again meet an ophthalmologist before deciding on a particular lubricant. In case of MGD or evaporative dry eye, it is extremely important to do warm compresses. You can either do this with cotton boiled in warm water or with a warm towel kept over the eyes for about 10 minutes or so. Make sure it's lukewarm. It shouldn't be extremely hot. There are masks that you get these days which can be microwaved and then used. These are silica-based masks which you can heat in a microwave and then apply around the eyes. They generally have a Velcro strap and an outer covering of cloth which can be washed, so they're reusable, and you can use these for up to about 6 months or so. Blink and screen hygiene, as I mentioned. If there are other problems like arthritis, now specifically conditions like rheumatoid arthritis or collagen vascular diseases or autoimmune conditions, those are fairly commonly associated with dry eye. Now, if you have these conditions and you are planning to undergo a cataract surgery, it is important that these conditions are well under control, which means that in consultation with your rheumatologist or with your physician, it's extremely important to step up systemic medication to control these conditions, and only after that undergo the cataract surgery. Otherwise, there can be problems like deficient healing of the incisions that we make or a severe dry eye post-surgery. Collagen vascular diseases like rheumatoid arthritis or diabetes or uncontrolled diabetes are contraindications for LASIK. So you would not do a LASIK surgery or a refractive surgery in patients who have these conditions prior to the procedure. And of course, if an MGD is detected, There are treatment options like vector thermal pulsations or intense pulse light therapy, which can also be done in addition to warm compresses, which also help to alleviate symptoms and help to prevent problems post-surgery. Another very common deficiency is vitamin D deficiency that a lot of us suffer from. If the vitamin D is extremely low, it is important to take injectable vitamin D. If the vitamin D is in the moderate deficiency range, then oral supplementation using sachets or with oral tablets every week is important for a few weeks. It is important to recheck the vitamin D levels later on, because vitamin D is not like vitamin B or other water-soluble vitamins. It tends to accumulate, and therefore hypervitaminosis or excessive vitamin D is also a bad thing. So it's important to check this once you've done your supplementation to make sure it's not gone too high and that it's maintained in the normal range.